Yesterday I published an essay on hydrogen medicine and its successful use in treating a patient with brain cancer. It's a case study done in China. It was published in October of last year. And it was a patient who had multiple tumors in her brain and also lung cancer and liver cancer. After 4 months of almost continuous or 3 hours a day of hydrogen treatments, all her tumors in her brain were shrinking, and after a year, gone. She had no more brain cancer, though she still had the lung cancer and the liver cancer. I originally titled the essay, Hydrogen Cures Brain Cancer. I changed it and wrote a letter to the FDA at the bottom of my page saying I'm changing it to Hydrogen Treats Brain Cancer. One, the cure word is a very strong word. FDA doesn't like that. And really, the only way you can honestly use the word cure is when you have a treatment that cures everybody. It's a cure. Like iodine cures goiter. It's a cure for goiter. It'll cure everybody of goiter. But when it comes to cancer, no single agent, hydrogen or bicarbonate or magnesium or chemotherapy or anything one does is a cure for cancer, because it will not cure everybody. It is one of the reasons I'm in a protocol. I'm so much into protocol, meaning never depending on one treatment. Now, they use hydrogen therapy as a monotherapy, as a standalone therapy, and had great success, but did not cure her of all her cancer. So when you add things like bicarbonate and magnesium, and megadoses of selenium and iodine, and go into a whole protocol, get a hold of your breathing. But this case study is like a landmark. Here we have published from reputable hospitals in China that did this research, that they used hydrogen therapy, inhalation therapy, and had total success with this particular patient. It's not a study, it's not multiple people, but it's enough. It's enough to understand that for brain cancer or any cancer, one should not overlook hydrogen therapy, hydrogen inhalation therapy. It's a wind that blows one away from death's door, whether it be because of cancer or some other serious situation. Hydrogen is a gas of life. And I always refer back to, even though hydrogen medicine is only like 10, 12 years old in Japan and China, it's only really come strongly to the United States in the last 2 and 3 years, spreading around the world. But I always go back to 70 years ago, when a deep-sea diver from Switzerland went down almost 2,000 feet, about 700 meters. And how did he survive under almost bone-breaking pressure, cold, stress? He breathed 96% hydrogen and only 4% oxygen. So as more and more research comes out, hydrogen medicine is going to, like it is coming for cars and planes and buses. We already use it for rockets. Hydrogen will come into its own as a primary medical gas, primary substance for healing, and in the future in hospitals, when they apply oxygen, there should always be a hydrogen, just like there's always CO2. So take hydrogen seriously. Doctors are going to be the last ones, and the FDA going to be the last ones to jump on board. But there's no stopping hydrogen. It's going to save the world in terms of energy, and it can save your life.